Thank you. Good morning, Lizo, and to your viewers. I think that we've been worried about the third wave even before the second wave ticked off, the moment we realized that we're not going to have a vaccine. And what we are doing is we're basically looking at patterns, and we are studying patterns. And we're looking at patterns historically, looking at the Spanish flu and sort of similar pandemics or epidemics. And we are also looking at patterns in other countries to see how the pandemic is unfolding. And we're looking at the epidemic curve and some of the things that drive the epidemic curve. So we are seeing in South Africa that the way the curve is unfolding is that it tends to take a break for a few months, and then it will then increase. And we've seen that pattern elsewhere. For a while, we thought that the second wave can be avoided, but it wasn't. And we started to have the new variants. And now we are having winter again coming at a time when people will not have immunity. And those who had immunity in the first wave, their immunity would be depleted by then. So we have got reason enough to think that without any public health intervention, we are likely to see the third wave around winter.
Around winter. Okay, so you've given us the possible timeline just based on the patterns and the studies, obviously, that you've conducted to date. But we're looking at the rollout of the vaccine, the vaccine strategy. There are also issues of vaccine denialists. We're also looking at, people who obviously are hoping that the 2/3 herd immunity will, in fact, not be achieved by the end of 2021. So when we factor in all of these, I mean, what is the likelihood of the vaccine strategy plan in achieving those goals?
Yeah. And once again here, Lizo, we are aware, we knew when the timelines were given that the priority here will be health workers, and that it's unlikely that the vaccines for the general population would be rolled out before winter. And remember, the vaccine, people need to be vaccinated at least 1 month before the possible time of exposure, right? So you can imagine that really, if we want to have herd immunity, we must have a large population vaccinated by end of May, around there, right? So that is unlikely to happen. And so we acknowledge that the vaccine strategy that we have is likely to take effect towards the end of the year. And because it's likely to take effect towards the end of the year, a wave that we saw now in December, January, is something that can be avoided with the vaccine strategy. But to avoid a third wave, we are not going to be relying on the vaccines themselves. We are hoping that what the vaccines for health workers would do is to preserve the integrity of the healthcare system throughout winter. But we still need public health interventions like behavioral interventions and preventative measures in order to cope with the possible third wave that may come around winter.
Well, Prof Mosa, you've actually just, touched on my next point. So you've spoken about the vaccine rollout plan, which is a 3-phased approach. And as you alluded to, healthcare workers and population over 80 years old will be privy to accessing this first dosage, which is set to arrive tomorrow, in fact. But I want to look at, the public healthcare system overall. We're looking at how it has been exacerbated by the COVID-19 pandemic. But, some of the challenges that it is facing now was obviously, there way before the pandemic, and many had voiced and expressed their concerns about that. So in terms of just the overall public healthcare system, when we're looking at the vaccine rollout, the logistics, we're looking at issues of corruption and even just staffing, access to staff who are healthy and available. What are some of the comments you have in that regard? What are some of these suggestions we will have to look at if we are going to face this possible third wave?
When it comes to the vaccine rollout strategy, the way I look at it is that, first of all, we need to overcome this challenge of agreeing or disagreeing on whether we should have vaccines. The sooner we agree, then we limit the denialism that you mentioned earlier. And that will help us to get to a point where we can actually put in a lot of effort on procurement. And procurement here, I just don't mean procurement expecting government to bring vaccines. I mean mobilizing the whole of society to make sure that we mobilize our resources to procure enough vaccines as soon as possible. It's hard to get to that point when there is still a lot of bickering and disagreement and so forth. And that then leads to the next part, which is the distribution. And the distribution of vaccines for healthcare workers makes sense to do it through the healthcare system itself. But the distribution to the rest of the population requires something more than that. The healthcare system on its own and health facilities are not going to be enough to roll out as fast as possible. It might look good on paper, but in reality on the ground, we also need partnerships outside of government. And this is something that we've been drumming again and again. And I just want us to get past that and agree that, okay, what's the role of the business sector? What's the role of the NGO sector? What's the role of the unions? What's the role of political parties in making sure that we are moving on the distribution strategy that involves distribution at community level or even house-to-house visits with community health workers, especially when it comes to rural areas. And otherwise, we're going to end up with some effective distribution in the city, but not so much in the rural areas. The point here is that vaccine needs to get into the body. If the vaccines are not getting into the body as soon as possible, then we are delaying the benefit and the saving of lives through the vaccines.
And then, Prof, I mean, in the same breath, there are also the socioeconomic ills and constraints that we've faced through the triple threats of, poverty, inequality, and unemployment that's obviously also been exacerbated. So access to health, to food, access to services that could also help mitigate against some of the mental challenges that people are facing during these unprecedented times. I mean, we're looking at, an overall, support or lack thereof for people, particularly those most vulnerable. Has this been considered at all?
Yeah, that's a tough one. And that's a really important question. And to be fair, I don't think that we've addressed this enough. I remember early on in the pandemic, when we did the lockdown survey with the Human Sciences Research Council, we raised this issue of food supplies and access and transportation, all of those problems that we identified then. And it was clear that the debate was focused so much on health, and health meaning the medical side of health, as well as the economy. And we kept saying that, look, there's a third leg here that's missing, and that's social support. And when that was translated, it was translated into social compact, which is mostly around solidarity, instead of actually looking at the sort of psychosocial support that is needed. And now with the second wave, it's worse because people have lost loved ones. A lot of people have died. A lot of people are hurting. A lot of people have lost breadwinners. It's just a lot of people have lost jobs and businesses. There's just going to be such a huge burden, not just on healthcare workers who we saw suffer from burnout and moral injury of having to make difficult choices, but also the rest of society. And it's not just in local communities only, rural communities. It's also in some affluent communities where businesses have been lost. So it's a whole society problem. But I have not seen any concerted effort, even discussion or plan on how we're going to deal with psychosocial health. And this is similar to behavioral interventions. In South Africa, in terms of our approach to health, we don't focus on prevention, we don't focus on behavior. And that's why whenever we need those interventions, they are not effective enough. But people are becoming aware that these are important, but we haven't gone as far as you say, how do we actually make sure that there is protection, social protection and support, especially at the community and individual level. And that for me, I think that it's a debate that is still open. We haven't really come up. We're still focusing so much on biomedical interventions and the biomedical technology to solve all our problems, but it's not going to deal with our psychosocial ills.
Now, Professor Mosa, I mean, you earlier on, you spoke about the patterns and just after studying, previous pandemics, what's emerged. You've given us a potential timeline about this third and even fourth, peak that we might experience, or third wave, rather, that we might experience towards the beginning of winter. Now, I just want to look at the options available for us going forward. So currently, as we know, we are on a national lockdown level 3. It's been adjusted and amended to date. Obviously, that culminates on the 15th of February, and we're yet to hear from the President and the National Coronavirus Council on where to from here. But when we look at those dynamics heading into winter, etc., what are some of the cards, that the NCCC might be able to play with during these unprecedented times, obviously having to balance the economic woes that we're also facing as a nation?
Yeah, very important question. So for me, here's the thing. When we were faced with the second wave and we realized that there is a new variant, there was a sense of doom and helplessness that's it, we are finished amongst a lot of people. We did not think that we could actually control the variant-driven pandemic with behavioral interventions and these sort of alert levels, restrictions. But we did. And the most impressive of the provinces for me is Gauteng, because when we predicted, we thought that Gauteng was going to have a worse epidemic than they had. But the level 3 lockdown came in time for Gauteng and provinces like the Free State, where their surge was a little bit delayed compared to Eastern Cape, Western Cape, and KZN. But we have seen now, if you look at the curve for Gauteng, it's similar to the first wave. But then for places like KZN, it's almost twice as high as the first wave. So we've seen now that the level 3 restrictions were quite helpful in bringing down a pandemic that is driven by the new variant. So for me, I still think that we've got things in the toolbox using what we have. The problem is that, as we've discussed, that these level 3 lockdowns have impact, a negative impact on schools and on businesses, on various other aspects of society, like the alcohol industry and so forth. Now, we need to agree that because we're not going to have the vaccine in time, we need to prepare ourselves for a level 3 lockdown, one more level 3 lockdown around winter, and try and institute it early enough before we see the havoc that we see. For the second wave, it was introduced late, to be fair. And understandably, people wanted to have their festive season. But we know we're going to have Easter, we're going to have travel. That's going to drive, those things are going to drive infections, those interactions. But soon after, we're going to have to agree on going for one more level 3 lockdown as we roll out the vaccines. And for me, I think that if we do that in time, we can then agree on reducing restrictions, maybe in the coming week or 2 weeks, reducing restrictions so that other parts of the industry can start kicking and compensating for the losses as much as possible, but have a set date or a predicted date that is advised by the advisors to the President and the Minister of Health, whereby we may possibly go on to level 3 lockdown and start planning now for that level 3 lockdown. And if we agree that one more lockdown, but after that, make sure that the vaccine is rolled out to most of the population, then by December, we may be in a good shape.
Oh, Professor Mosa, we're going to leave the conversation there. Thank you for joining us here on Weekend Dawn.